The new approach here was to begin this project looking at local communities, and rather than prison, look at jail and community corrections and emergency department, local acute care hospital utilization as a place to start.
There is not always the best answer when it comes to addressing behavioral health issues in our criminal justice system. In January, the Jackson County Local Public Safety Coordinating Council met to discuss community resource alternatives that research is showing may not only be less expensive, but more effective at rehabilitation.
And I think this does kind of reflect what we're hoping that this group has become, which is that place in our community where we can have discussions around behavioral health and public safety and what our needs are around enforcement, what our needs are around treatment, what our needs are around housing. And this continues in that tradition. About a year and a half ago, maybe 2 years now, I had the opportunity to sit on a statewide committee to look at what we wanted for around justice reinvestment, but behavioral health. So JRI was traditionally used for nonviolent drug and property offenders to look at alternatives to prison and what we could do with the savings by utilizing community resources rather than state resources in prison to work with folks who are dealing with addiction and when that addiction is fueling their criminality. So the thought was, what could we do to look at behavioral health in a similar way? And a group came together, 3 or 4 different meetings, and at the center of it was Steve Allen, who at the time was with the Council of State Governments. And currently when we see the impacts grant process, that's the byproduct of that group that Steve headed and got these results from.
A number of things happened in the course of this project that were unique, and as Eric mentioned, at the time I was working for the Council of State Government's Justice Center, where I had worked for 4 years, worked in 10 states, and my role was to look under the hood in states and see what they had, see what they needed, make recommendations for improving behavioral health services, especially for complex criminally justice involved individuals. As we came to Oregon, there was a number of unique factors, and what had happened just prior to this Oregon project was our funders, the Bureau of Justice Assistance, convened a 50-state forum, and the idea was that justice reinvestment projects through BJA, through Pew Charitable Trust, have been going on for some time. Oregon had benefited from that work. What was the next iteration of justice reinvestment type projects that the states were really interested in? And so they had an opportunity to raise their hand and say, here's this new project idea that we have, would you consider funding it? And Oregon's project was the first of its kind that looked in 2 ways. One is all projects prior to that had been state-based, and what I mean by that was very similar to the prior Oregon justice reinvestment, where the idea is either to not build a new prison or to even stop using a prison and use that savings from a prison-based approach to criminal justice to infuse it with community resources to impact public safety over the long haul. The new approach here was to, instead of looking primarily at the state level, and as you'll note, there are some state implications for this, look at the local level. So begin this project looking at local communities, and rather than prison, look at jail and community corrections and emergency department, local acute care hospital utilization as a place to start. So engagement with local communities, and that was important because in many cases in prior justice reinvestment projects, and I'm not speaking about the Oregon project because we weren't involved in that project when I worked for CSG, but many times local communities felt like the state was solving its problems in corrections on the local government's back. In this case, the whole project started with a local initiative, which we thought was really cool, and BJA supported that. The second unique factor was a focus on behavioral health, and as you might guess, increasingly over the years, behavioral health became a focus of all of these justice reinvestment projects, so that's why we were busy in this space. But to have it be the focus of a project was the first of its kind. So the Oregon project that led to the Senate Bill 973 and the Impacts Program was unique on those levels. Another unique aspect was the way that the data was collected, and Eric has alluded to combining multiple sets of data that we had never been a part of, and Bureau of Justice Assistants had never been a part of, a data analysis that was so robust. And that's the piece that Eric and Stacy wanted me to bring forward today, but happy to talk about the other aspects of this project. Part of the reason this is important right now is because the Impacts program, and Stacy sits on the committee for that, the grants committee, it's rolling down the pike, and those fundings, the $10 million that was set aside for local community pilot project, will be going out the door later this year, hopefully by late spring, late summer at the latest. So you here will have an opportunity to write a request for that, and it may be helpful for you to zero in on the population for which this project was intended. Having sat in on the meetings this morning, it also seems like this hits right square where some of the challenges that you're currently struggling with in terms of aid and assist and guilty except for insanity population, sort of that this project fits really nicely with some of the challenges that you're presently working on.
Want to finish watching the entire meeting? Visit jacksoncounty.org. Click on Departments. Choose Community Justice. Then, under the General tab, scroll down and select Public Safety Coordinating Council Overview, and look for latest news.